to get away from it. I think we're good.
All right, so we're continuing on with some of the videos. You'll have access to this, and Luke tells me that the YouTube channel is officially up and running. So I have no idea how to get to it, but fortunately he does. So. Health Enrichment Center.
Health Enrichment Center, Sandy Fritz. Those are your keywords.
So the topic that we've got with you guys today, this is the students today, is we're trying to manage this idea of indications, contraindications, and we're also working on assessment. Are you guys on the YouTube channel?
Yeah. Because I won't remember.
Okay.
I'm really bad.
So, so the focus is the shift from the general protocol that you've been learning, how to get efficiently through the entire body, doing an excellent general massage with moderating pressure, with the overarching outcome of wellness, relaxation, and the focus in that outcome is that even if there is a pathology or some level of discomfort or whatever, we're relying on the general full body massage to be the intervention that's just going to take the edge off of all of that. And then the advancement on that is that as you move through the various body areas, you are sifting through the various tissue layers, you're moving all of the joints, and we're going to introduce the idea of an actual muscle test today, that in addition to that general outcome of wellness and relaxation, you're also being mindful and doing assessment, right? Right. All right. So the stuff that we've been having you do, like move all the joints and put them in different positions and all that kind of stuff, is now you need to pay attention to what that is telling you. So this is a big shift. This moves from kind of a cookie cutter recipe approach to massage to a critical thinking approach to this. And we're pushing you at this really quick. You know, you've only been in the program like, what, 2 months now? 4 months? What happened to the other 2 months? I think I had the flu. I was sick. In your fundamentals textbook, I gave you some pages to start to look at. So let's look at the first one. And it's on 439 for the camera. It's this amazing book right here. All right. This box is giving you the general assessment ideas that you would use based on a variety of outcomes, the 4 major outcomes that people come in with. So you're going to learn all kinds of assessments, but that doesn't mean you're going to use them all the time. So if an athlete comes in and it's a high school football player or something like that, and you know, they've got a little bit of they twisted their ankle just a little bit and whatever, you might want to use some of the more orthopedic screening to tell if you need to refer them, or to get a general idea of, is it a grade 1, a grade 2, a grade 3, and how you would adapt to that. That's a much more involved, got to do this assessment and this assessment and this assessment. So for that functional mobility outcome, you might do more of these physical assessments. Somebody's got stress management, you might be more about looking at their breathing and doing more interviewing. What's your sleep cycle like? So that's what this box is doing, is giving you some guidance on that. Now, as you are going through and you start doing your clinical stuff, we're going to make you do a pretty comprehensive assessment on every client, because you need to learn how to do it. But when you get into your own practice, then you're in a situation where you're going to pick and choose these. Because there's only so much you can do in that 50-minute time slot in the standard hour massage session. So paperwork that Luke is going to go over with you is a way to capture that information, and it gives you a checklist so that you don't forget something. I would forget something if I didn't have a checklist like that to go through. So this particular box talks about the relaxation outcome, which is the foundation. Everything that we do should be, for the most part, embedded into that outcome. So I've been thinking, how does massage in a self-standing intervention or occupation, how does that differ from what people like to call manual therapy? Massage is manual therapy by definition, but there are other forms of manual therapy. So you see manual therapy all the time in the physical therapy, all right? But it's usually not embedded into a full body massage session, which has its own baseline value and outcome. A person comes in, they have a chief issue, a complaint, they can't move their head, they've hurt their knee, whatever. The physical therapist does an assessment in that area, and then they might prescribe a hydrotherapy or a thermal therapy or exercise or a form of manual therapy where they work on whatever is going on, some tissue tightness here or a little bit joint problem there, and it's in that spot. It's all targeted to that spot. Does that make sense to you? Okay. So in the massage world, there's a group of people that somehow or another don't understand or don't appreciate the value of the full body massage, which, as far as evidence is concerned in research, like for anxiety or depression or fatigue or pain, the research supports the full body work, not the targeted spot work. They think that they have more value, or they're doing advanced work or something like that by doing these isolated manual therapy methods. So the way you're going to learn to do this is your general full body approach with the right kind of pressure for them in the right spot, the right speed, that feels essential to that person, is therapeutic in and of itself, and probably the most therapeutic thing you will do. In addition, it's going to become your assessment process so that you're going to be able to assess tissue texture, body rhythms, joint function, strength, muscle interaction, functional interaction, how does the person move, gait, you're going to get all of that. And then you're going to get interventions. Interventions are something that you only do when assessment indicates that what you find should be altered, which means that it's not a resourceful compensation, or that it can't handle that right now. We talked about the heart surgery I had. You wouldn't want to breathe, or you wouldn't want to work heavily on my breathing function 3 days after I had my chest cracked open, even though the breathing function was definitely altered. But you could work on it now, 12 years later. But there's a limit because of the way the thoracic cage, the rib cage, and the spinal attachments of the ribs, those are just never going to be the same, and wired up and all that kind of stuff. So you're not going to take it back to the way it was. So I'm stiff, and there could be some improvement that goes along with that. So I would find that in my assessment. I would determine through my critical thinking, is this something that I should bring my focus in on a little bit more? Does this fit with the outcomes that the person is coming in with. If I'm coming in just because I want to have a ability to just kind of like I got wrinkles in me and I just want the sheet, you know, shook out so that I just feel better, I don't want you messing with my breathing. You know, I also got that funky knee with no ACL in it. I don't want somebody messing with that at all because it's inherently unstable. So, and when it is stiff and has limited motion, it doesn't hurt. When it's got full range of motion, then it hurts. So, you know, you need to be able to discern what you're going to focus on. Okay, so you make a decision based on the outcome that you're going to do an intervention. You're going to see if you can challenge the anatomy and physiology and get a shift with it. I realize as I've been kind of grappling with this idea of what's the difference between manual therapy and massage therapy, and you know, Luke, you working with the athletic trainers and all that kind of stuff and what they do. And what I realized is that the interventions we teach to our massage students are all of the other little manual therapy things that they do. It's just that we've got you embedding those intelligently into the general full body massage that has its own therapeutic. Now, I'm not going to, there's a million names for the same thing. So we're going to try to get a generic idea on that. Luke,
But
you
that would be the idea that massage tends to be, I think you can hear me, but massage tends to be about the full body wellness, maintenance of homeostasis, shift of parasympathetic dominance, all that kind of good stuff, right? Versus manual therapy techniques tend to be all the intervention techniques, regardless of how they're labeled. Doesn't matter if it's ART or if it's the contract, relax, antagonist contract. It's some kind of intervention, usually associated with compression plus a passive or active movement. So I agree with her in that manual therapy is more about the specific interventions, targeted interventions, but we sprinkle it into the whole wellness, full body approach as massage.
So the example I gave you earlier when we were discussing this about a cookie. And so the basic ingredients of a cookie are usually flour and butter and sugar, and that's a shortbread cookie, you know, they're good. And there's tremendous value in that cookie right there, because it just takes you away from your world for a few minutes, right? That's a metaphor for the general full body massage. There's value, tremendous value just there. But maybe I want to put a little vanilla in it. So I start adding some seasonings, and that enhances the taste of that cookie. But if you ever had a teaspoon of vanilla all by itself, it's not very good. Some raisins sprinkled in, and maybe even adapting that base recipe to an oatmeal cookie by putting some oatmeal in there. That might be a way of thinking about how we would modify the massage to some of these other outcomes: stress management, pain management, functional mobility. But you wouldn't want to just eat oatmeal, you know, like take a hand of oatmeal and do that. And some people really like raisins in a oatmeal raisin cookie, but they don't necessarily like a handful of raisins. So what I see a strong differentiator here is we're moving to this idea of critical thinking and intervention. You never do an intervention without an assessment first. The general full body massage, mindfully applied, is going to create a lot of therapeutic benefit. You only apply an intervention after an assessment is indicated that there is a reason that what you're thinking about might be of benefit, that there are no contraindications, that could be a safety concern or make the situation worse, and that the person has the adaptive capacity to be able to, their body can absorb that stress. An intervention is always a stress or strain into the system. So it can absorb that, and it has the ability to shift. So the other assessments, the other outcomes we have then are going to have increasing layers of assessment that you're going to look for. So the next one down on the list is stress management. So up on the relaxation outcome, we're primarily looking for, is there something I need to do different so I don't harm them? Do I have to position them in a certain way because they aren't comfortable laying on their tummy or something? That's what we're looking for in our initial assessment. Are they taking a medication that I need to understand? So so that maybe they'll get up off the table, might be a little dizzy. Maybe I need to stay in the room. That's what that initial assessment is. So we always do that. We always do that. This is charted and documented. Then we start to add in to the recipe. So if a person's outcome is stress management, which is extremely valuable in any pathological situation, or somebody is under a lot of pressure to perform, or any of that, they got pain, there's going to be levels of stress. Then we're going to start to layer in a level of assessment to that, which is breathing. That's the primary place we're going to focus. And then if you look there, it tells you that. It's giving you an idea of where you're going to go with that. So it explains what stress management is in the book, and then it tells you what your assessment and treatment recommendations would be. So, includes procedures for relaxation outcome and adds to the following. You increase your client history. You start to ask more questions. How is the person experiencing stress? Some people want to curl up on a ball and sleep. Other people need to get out and move and run. You know, sometimes they can't fall asleep. Other times they can't stay asleep. Maybe they're eating or not eating, or it's the stomach, or maybe it's all of them. You know, how do they know that they're stressed, right? This is what you would do during your conversation, your history taking with the person. This would fall into the S, or subjective information, when you're starting to do your charting and documentation. You're going to also want to do a physical assessment. You're going to look, how symmetrical is their posture? Are they breathing with their upper body? Do they have a big forward curling in on themselves that would interfere with how the mechanics of the breathing would happen? So, you know, there's new research that says, or a reevaluation of the old research, maybe not. Maybe these physical elements, like being able to have some curvature, or have some forward stuff, or have a forward head position. Maybe not. Maybe those don't add into the idea of a person's pain threshold, like if their back hurting or something like that. But it's sort of logical, and you guys can do this yourself. You see somebody coming in and they're really rolled forward and their head's down. Try to take a deep breath while you're doing that. Assume this position with me. Now try to get a deep breath. You can't, can you? All right, so then, you know, let your scapula come together in the back and bring your head up a little bit. And now see if it's a little easier to do that.
That's perfect.
Okay, so if I see somebody come in and I see these postures in here, I'm immediately going to go, oh, that's a cave. That's short in there. And then where's it all long? In the back. Now, where's the symptom going to be primarily? My back is so tight, and it is. It's taut. It's taut. But massage is really good at making short stuff long, and it's really good at making stiff stuff more pliable. And this is already kind of long back here. So we've got to help the person understand, okay, I need to open you up here a little bit. I might need to use some interventions in here to try to bring the tone down in some muscle. That might be the one you've learned so far is inhibitory pressure. Just press on the spot that recreates the symptoms, and movement. You could do that. Might have to get them to increase the nervous system signaling to the stuff in the back. They may need to have some therapeutic exercise involved with that. If it's really an issue, maybe they need a referral to an exercise physiologist or a PT to help them understand what's going on with that. So there's a level of complexity that comes with that next goal that is going to influence the assessment. So in the textbook, those are listed there. I've pretty much gone through them with the demonstration. The next outcome that research shows that we have evidence for is pain. Local pain, functional movement level type pain. People experience it as low back pain. My shoulder hurts, my neck's stiff, my knee is ouchy, you know, and general, more systemic based pain like fibromyalgia is a common one, or chronic pain syndrome, or pain related to rheumatoid arthritis, or persistent chronic headache type pain. We're good at that. The thing to remember is that the thing that helps pain the most is the relaxation based general massage sprinkled with a few little interventions, not a lot, just sprinkled, that recreate their sensations so that you can show them, yep, see, right there, I get my fingers on it, you know, take the scary out of the pain. You will not die. Here, look, you know, you can do some of this at home. You can sit on a golf ball or whatever. And at the same time, we need to screen and make sure that there isn't something serious going on there. And like we explained before we got into this segment, there's a lot of little symptoms that kind of one at a time, they don't really indicate anything, but you start to see them together and you start to wonder if something else might be going on, especially with the systemic fatigue and pain that goes with that. So what do you do with that? What did we talk about earlier? What do you do when you see that? You refer. You refer to who? Their family doctor, their general physician, and then it's their job to get them to a specialist if they need to do that. Can we educate the client? Can we give them a health messaging on that? We're not diagnosing when we say, look, here's this picture in the book that talks about referred pain. You know, mention this to your physician, or let's look up this cluster of symptoms that you've had for the last 3 sessions on Medline Plus and see if there's something there. You can educate. Educate and refer. Educate and refer. And then if there is a diagnosis of something, now you have to consistently consider when you're giving them a massage, what treatment are they undergoing? Was it a hormone replacement? Did they have a surgical intervention? Whatever. You have to remember that that has to be a factor you have to consider. When you work in an interdisciplinary care situation, like Luke does with sports teams, or like you do in physical therapy, and even with you, where you have multiple professionals, and you actually will end up being dual licensed as an esthetician and a massage therapist. If I encounter something on the skin, and you work in the wellness industry, if I see something on the skin, I might say, let's have our esthetician look at it. They have a little bit more experience around that than what I have. And then the esthetician brings their increased level of skill in, looks at it, and then says, I really think you need to see your physician and I would recommend a dermatologist. You could do that within your added scope that I might not. I might just say that this has changed. I think you need to go see your physician on that. So Luke can refer things to the athletic trainer to look at. I don't have to do all kinds of specific joint assessment because the athletic trainer and the physical therapist that work with him can do that. My job is to recognize and refer. It's easy when you're in a group type setting. It's harder when you're a sole practitioner by yourself because you don't have that innate environment for you. So then our go-to on that is the general practitioner. Any questions on that? Does that kind of make sense of where we're going? And then the functional mobility, I think this is the outcome goal. You know, it hurts when I move my shoulder. I want to run a little bit better, those kinds of things. I think that's the one where we breach scope of practice the most. I think that's where we get in the way of athletic trainers and physical therapists and even occupational therapists and chiropractic even, where we start to think that we know everything. The main assessment that we should have in this regard is it more joint related? What is the level of the injury? If it's an orthopedic type injury, what other treatments are being provided? Let's refer this. Let's get the information back. Let's work in collaboration with that. And a lot of people in the massage community are really breaching scope of practice in this area. They're really doing assessments and interventions that really are better done by professionals that have focused on this with their training and operate in a much larger scope than we do. The ones that we do with this, we need to decide, is there a need for referral here? Is this a resourceful adaptation? Is this something I need to support, not change? Is it something that can be helped by a general focus as opposed to working right on something? All right. The assessments there then look a lot more like range of motion and muscle testing and all that kind of stuff. You know, some of the assessments I would do there, Luke would do that, would look very similar to what your PT is doing. The difference is I'm doing it to decide if it's something massage can do or I need to refer. The PT is doing it to decide what to do. There's a huge difference there. You got anything to say about that, Luke?
He is indicating we're usually ultimately always screening for contraindications. All other professions are, but they may also additionally be diagnosing. So I need to screen that this isn't something that massage could potentially harm. And so then that's where all these various assessments come into play. So whether it be range of motion, muscle testing, if a lot of it, ultimately, our best value is to start with the least invasive procedure, which usually is the general protocol, and then work our way steadily out from there as we continue to see a positive result. As soon as I see the positive results either plateau, or if I ever see an exaggeration of a symptom post doing anything, I know to stop doing that.
Yeah, learn to know what not to do and work more general rather than very specific. You'll be surprised what you can accomplish.
And by working more general than specific, you're almost always much safer. So start there and work your way steadily through the intervention.
Okay, on page 443 is something that you're going to do for hands-on practice with Luke, and it's a goofy exercise, and I want you just to do it because I have gray hair and I'm experienced, and I know that it's good for you, all right? It's a script. It's a script that you're going to read that says, number one, come here, Luke, for a minute. We'll knock this up for a little bit. It says, greet the client, smile, introduce yourself, extend your hand, and give a firm handshake. Hi, I'm Sandy. I'm your massage therapist today. We're going to go through a little procedure here so that I can figure out how to do the very best massage for you. Okay? Ta-da! Not,
Awkward.
hi. I kind of don't know what I'm doing, but you know, I got this routine I'll follow, and maybe you'll feel better.
Fake it till you make it.
All right, you
Or
gotta
come
know.
in and fist bump and be like,
Come on, man.
you gotta have some professional demeanor, right?
All right, then the next part of it is initiate conversation, ask how the client would like to be addressed. Mr., Mrs., Ms., first name, whatever. And then you're going to explain your little assessment process. And you've got, this is going to be tedious to begin with to learn it, but eventually you got to get concise and efficient. But that comes after you've learned the elements of it. So,
And like anything, worst case scenario, you now have a good reference point. Between this and the various types of paperwork that we're giving you guys, as she was indicating, having a good checklist of making sure you're working your way through all the physical assessments, as well as these elements of courtesy, whether it be using proper pronouns or confirming whether or not they need quick access to a bathroom, or, you know, just all those kinds of dynamics. You'd be surprised at how much you need to kind of work your way through in relation to a script associated with just screening for their comfort level as well as all the contraindications. So
we need to
these reference points do that for you.
we need to be very culturally aware. We need to be gender aware. We need to be, not coming across with a judgment, and make sure the person feels like they're accepted and they're understood.
It can even be someone that has a physical complication. The key thing to ask is, educate me in relation to how much help you need. You know, you have to ask that question and have them guide you as to whether or not they need help being guided to the table, or they need help on or off. They may not want that. And then that's ultimately, but that's provided by you asking that question.
So there's a whole list of things that you're just going to sit with each other and you're going to read it to each other. All right, so that you get an idea of what those questions are like. Okay, then you're going to begin the formal history, and you've got a piece of paper for that. Luke's going to give you one of our more complicated or complex papers. It's got a lot of in-depth cheat sheet stuff on it so that you can help. You know, be very stereotypic with this. But you're listening and trying to identify the client's story is where you're going with that. And then, I have to read right here, you tell them what you're after with the history form and why you need to know some pieces of information. People say, well, why do you need to know what medication I'm on? What's that got to do with massage? It's got a lot to do with massage. It changes how I might have to adapt to something, but they might not know that. So, you know, we really use this time to get to know the person and they get to know us and how we go. Ideally, with a first-time client, you would spend 45 minutes doing this. Reality, you're going to do it over a series of sessions at 5 minutes at a time. All right, so you need to tell people that. This process of me getting to know you and you know me as a massage professional is going to take time. We can't, you know, we have to understand that. So it may take time before I start to move in more specifically on your target area. I have to know you first. All right, so you're going to use this. You're going to follow the sequence on the form to gather the information. By this time in the activity, typically students are going, this is dumb. And you start to giggle and carry on, and that's all right. You can do that, all right? But just keep going through there. Then you're going to summarize the information, make sure they understand what it is. And then You're going to follow the script as you continue on and explain the physical assessment and then how you're going to develop your treatment. So that's the thing you're going to do prior to the hands-on today. The other thing I want to bring your attention to, this is something you want to keep coming back to. It's on page, what here? 448. This is a pretty cool box in the textbook. And what it does is it gives you examples of the forms that are in the books and tells you what to do with them. And it takes you right through that same sequence that I showed you what was going on with the script. Okay?
Just confirm that's fundamentals.
That's fundamentals.
Show the cover again. See, there it is.
I am the author of this book, but guess what? Luke, in the new editions, Luke is co-author on these.
Officially. Thank you very much.
And he earned every bit of it.
Wow.
And that's where his bachelor's degree from CNIs came in, because as an academic publisher, they have to have the ability to show that they have gone through the stuff with that. But on the new covers, it says
Nice.
Sandy, Fritz, and Luke.
It's very exciting.
All right, why don't
Okay,
you cut
I'm
this
trying to
one?
cut this one. Goodbye, everybody.